With me today, I have Dr. John Scott, and he is an emergency physician and retrieval specialist from the Gosford.
Oh, actually, yeah.
You do.
I'm not a retrieval specialist.
Yeah. Okay. Well,
but I've done some retrievals. Put it in there. Yeah.
let's put it in there.
I
Why
could
not?
do
We
it.
can do it. Yeah. Look.
Yeah.
Don't get the people who care about those titles. Don't get your nose out of joint. He just does that. But
Yeah.
but we're emergency doctors effectively with a qualification behind a name. So someone endorsed us,
Yep.
and we're both very keen on holistic care and the importance of kindness. But I wanted to ask you, from your experiences, I thought we'd just have a little bit of a recorded talk on, kindness from the front line. There's some challenges. We're on the front line right now. I'm in an emergency department behind a closed door, and you're at your home after doing an evening shift, and the previous night. Is it worthwhile, and what are the benefits, of any? And I thought it would be good if let me just see, if we just talk about these things really, and probably you could start with self-care and high pressure environment, but also, what is kindness and mindfulness. So that's what I thought I'd just put out there. And let's see if you want to just maybe share a few words on things from your point of view.
Sure, Bish. Yeah. It's funny. I'm so pleased that this has become a sort of a more popular topic that's getting a bit of press and a bit of momentum behind it, because I've been doing the wellbeing portfolio up at Gosford for a while, and I got into that because I was a bit disillusioned with the way we sort of looked after ourselves going through advanced training, and thought that could definitely be done better. So then I sort of took on this project and tried to work out what wellbeing really is and how we can look after ourselves in emergency medicine in particular, to make the job more enjoyable and give us more longevity in the game, and hopefully so that actually perform better and provide better care as well. And in that journey of all that reading, really what it came down to was culture and kindness being the center of the culture that tied all of that together. Without kindness to ourselves, we can't be kind to our patients, and we can't give good care if it all stems from kindness. So really, I think that's the glue behind it all. And I think if we really think about why we got into medicine in the first place, most of us, it was out of a desire to be kind to other people. But I certainly found that when I was going through my training, when you get knackered and exhausted and burnt out, and sort of that cumulative burden of those endless evening shifts and all the extracurricular things that you've got going on, you stop being kind to yourself and you start resenting your work, and then you really can't be kind to your patients. And that actually, some people may say, well, does that really matter? As long as you're making the right diagnosis and prescribing the right medication, who cares if you're really nice to them, if you get the right result and they go home taking aspirin or statin or whatever it is that you've deemed that they need. But that's actually not the case. You can't even make the diagnosis if you haven't been kind to the patient, if you haven't built a rapport, if you haven't taken a thorough history that really gets to the root of what's wrong with them. Your chance of making that diagnosis is massively reduced, and therefore you can't give quality care. So it's not a one or the other kind of thing. I think it really has to be at the core of what we do. And unfortunately, the work that we do does make that difficult sometimes, or we can lose sight of it. So I think these kind of conversations are really paramount if we want to continue giving really high level care to our patients, and be able to do that for a long time. I guess that comes down to, it's a kind of a discussion of meaning as well, isn't it? It's another thing I've been interested about, is actually why are we doing it? Are we just doing this because it's interesting? We like solving problems. Because if that is what really motivates you, there's probably a far less stressful environments that you can go and solve interesting problems in. But if it's actually at the end of the day, which I think it is for most people, they actually want to make a meaningful difference to people, want to make a positive impact. Well, that's kindness, isn't it? Yeah. And so that has to be the core of what we do. So that's kind of a rambling answer to your question, I think.
No, I think it's a great answer. And I think just to recap on what you're saying is kindness is at the core. And also let's also question the why. And I think we often don't. And it's interesting. I'd like to reflect back that, you know, one of the things that gives me a lot of joy is teaching medical students. And one of the reasons is that often when you get someone new into this arena, the first thing I tend to ask them is a little bit about themselves and why, what inspired you into this. And often they've had some interesting stories about why, and then we forget that we've all had something interesting that made us go down this journey. It's not easy. It's not easy to do medicine, and it's a very rewarding thing. And that why is something that we can forget under the pressure. And I think also you just said that kindness is something that keeps it all happening. You know, it's driving us. And I guess that takes me to the next topic, because I've heard the phrase before, which always stuck with me, that that mindfulness is one of the highest forms of self-care, self-love, and you know, and giving yourself that intention, and that, because giving people attention, active listening, all these things are powerful mediums of displaying kindness, and listening to yourself, how you feel, is effectively what I think a lot of mindfulness is about. And I was curious.
Yeah, totally.
I'll just actually I put a slide on. First, this is a slide about the kindness ISBA, or the K ISBA, and that's something that's promoted, which is basically just putting kindness in front of the ISBA matrix for talking, introducing yourself and talking about patients. So it is something that we've done in our department, and we've this laminated piece of paper has now been lost a long time ago, but it's a useful reminder. And I like that little picture there, which says, even if we disagree about everything, we can still be kind to each other, which is the crux of pretty much our work in emergency, isn't it? Because we're constantly in disagreement, whether it's about whether someone should be admitted, or this drug or that drug, or whether we should have this patient from this bed to that bed. You know what I mean? And but I think kindness goes to three levels, right? Kindness is to self, to your staff, and also to patients. But I kind of think in the hierarchy is that if you don't start with self, you're kind of in trouble. And I think I might just, you've seen this picture.
Yeah, I couldn't agree with you more, Bish. And it's so important for the work that we do, isn't it? When we're working in these dynamic environments, lots of stress, different teams every day. Kindness is the glue that makes those teams work. You know, kind of like, you know, we like to think that we're like an F1 team, don't we? Sort of, you know, we come in there, patient runs in the resus bay, and it all happens seamlessly. But it doesn't, because we've always got a different patient every single time. We've got a different team, different personalities. And, you know, if we don't communicate well, that resus ain't going to go well. And, you know, I think really kindness, and there's some simple strategies that you can do, or you can use, that sort of really make those situations go a lot smoother, and a lot more enjoyable, actually, a lot less stress, and give you more energy for the next one.
And it's pretty simple. I agree with you. I agree with you totally. It makes everything go better, even in that scenario you just mentioned, and even just checking in. Now, what are some tips that you use to be kind? Say, I'm just curious in your practice. Like, I mean, like for me, like just how are you? Like we did a check-in at the beginning of this talk.
Yeah.
I felt that was really nice, because I felt like, oh, well, look, you know, we're meeting as people and humans, as well as, you know, educators and consultants.
Yeah. So I think what I do is normally in the morning ward round, or when we're sort of allocating the staff, you know, it's a little say hello to everyone, ask how they're getting on. And then back to you.
Yeah, back to you.
And then when I'm working with my team, I always like to, you know, especially if it's people I haven't met before, just before they present a patient to me, just ask them a bit about themselves. You know, where have you come from? What have you done? What are you interested in? Where do you want to go? And try and sort of break down that hierarchy a little bit, because people are often, you know, extremely respectful when they've got the consultant there. But if you can kind of bridge that gap with a bit of understanding and common ground, I find it makes the shift a lot more fun, actually, a lot more enjoyable. And I think it's also a safety thing as well, because people are more likely, if they've got a concern, they're more likely to come and tell you about it than feeling a bit ashamed that they don't know the answer or something like that. So, so it's just really showing an interest and listening, I think. They're pretty important tools. Work for me. And a bit of humor.
Yeah, why not?
Probably use humor for
Yeah. Awesome. Now, I've heard some good things also about you doing some mindfulness moments in your ward round sometimes. How does that work? Can you tell me some more about it?
So we're not doing them on the ward rounds so much. I thought about it, but I just think it's just been a bit difficult to sort of get that in there. But what I am doing is on my admin days, I run one or two, a couple of meditation sessions a day. So and that's difficult, isn't it? Because ED is such a variable beast. You never know what's going to happen on any day. But I'll see what the shift's like and try and maybe run a couple of sessions at 11 o'clock. So we just do like a mindfulness meditation for 10 minutes. I just use Headspace and just play one of theirs. And, interestingly, kindness has become a big thing. We've been doing meditations on compassion. So little guided meditations on that. It's been sort of a theme that we've been doing for the last few months. So we'll run like one or two of those. That's open to everyone in the department. So, the clerical girls at the triage, the nurses, doctors, PSAs, physios, pharmacists, anyone's welcome to come. I just put an announcement over the PA, just say we're having I call it a mental health education session.
Oh yeah.
So all the patients don't get offended that their doctors are nurses are running off to go and meditate.
Yeah.
Although that shouldn't be a problem, should it? You should probably want a doctor who's kind of rested and calm. But I used to say that, and politically I got a bit of pushback. So we say that, and then we do a couple of those. And if there's time, I'll do one at 3 o'clock as well.
You do one at 3 o'clock.
And that's the feedback from that's been really amazing, man. It's been really, really wonderful, actually.
Wonderful.
Yeah. Actually has been really nice is that, we do say a lot of like what the things that predict well-being is that those acts of kindness, and being able to set up a session like that and kind of give that space for people to relax, and then see them when they leave, when they seem that much fresher. It's a real wonderful thing, man. For me personally, like I get a lot out of that.
That's awesome.
That's really nice. Yeah. So that's kind of what we've been doing in terms of the mindfulness.
That must have taken a fair bit of courage to set up, because I've been on this space for a while, and I started introducing guided meditation using the Insight Timer app for 2 minutes, and I started doing it actually at the FACEM college presentation. So now every talk I give, I actually usually put a meditation in there.
Fantastic.
2 minutes, because then it's not a question of talking about it, it's actually doing it. And I kind of have this slide which I talk about what it's not, and all the misconceptions, and it's just to me it's about noticing and awareness, and all these things. I guess by calling it a mental health education session, that's a really good tip for me and others who are interested in bringing this in. And also, you also end up feeling that can you do it in this busy environment? Let me see if so like we did it in a disaster sim. Like is there a place for it? Well,
right.
I kind of think I got someone to in amongst the chaos, I got someone to take this photo of me just sort of taking a deep breath and just zoning out for a moment. And I found that's again the misconception is you need to be in a quiet room under a tree or something like that. But in actual fact, you can pull this out. No one even notices, right? Everyone's like, no one even notices that you're actually just taking a bit of time to check in with yourself.
Yeah, that's awesome, Bish. I was wondering about that actually. I always thought, next time I get a back call where you've got like 10 minutes to prepare, whether you could get everyone for just 30 seconds, just doing some square breathing or tactical breathing, whatever you want to call before, just to prepare themselves and calm the nerves. I've never done it, but
well, let's try. I've got the Insight Timer app here, and we could do 1 minute just for experiment's sake, and just we can comment on this later. I bet you the medical students that I primed in, they're probably walking in the middle of this, but let's just see. If you let me, you can give me some feedback, and I'll tell you what I do for 1 minute. So I'd say, you're already in a pretty relaxed space, but you might be able to hear the bell. Okay.